Hi, and welcome to this discussion about the ulna bone. We'll talk about obviously the bony features of ulna, we'll talk about the attachments of ulna, and obviously we'll be talking about the side determination of ulna. So, the very first thing that we need to do about this bone is observe it. Just observe the bone. It's a typical long bone, obviously, that goes without saying. But the first thing that I would like to draw all of your attention towards is look at its upper end. Its upper end is so very much characteristic, or rather unique, that we can easily make out that this is the upper end of the ulna. Whereas its lower end, well, not so much. Now a disclaimer here. Before we even start the discussion about this ulna bone, a disclaimer. As you can see, this part of the ulna is broken. And I did not have any other practical ulnar bone model, so I'm sorry. I really sincerely apologize. And what's even worse is that this part actually houses a process, so it's not like just a scrap of bone missing or something like that. This actually houses a process which is known as the styloid process of the ulna. So that part is missing, but it does not have much to, we don't have much to discuss about that process anyways. Just know that there is a process over here, and I'll also show you a picture from Atlas or from some other real bone. Don't worry, or you can search it up yourself. So that won't be affecting our discussion at all. I'm just mentioning that there is a styloid process over here, which can also help you in determining that this is the lower side and this, by the way, is the upper side. You don't need the styloid process. You can already see how unique the upper side looks. So the upper end of the ulna, as you can see, very unique, has these two processes, this upper process and this lower process. Upper process, this is known as the olecranon process. Lower process, on the other hand, known as the coronoid process. Coronoid, by the way, general information, it is Greek for crow's beak. I think everybody already knows that. So anyways, that's the upper end. This is the shaft of the bone, and this is the lower end. Let's first concentrate on the upper end, as we do with all bones. So as you can see, upper end, let's first talk about this olecranon process. So olecranon is the superior of the two processes, right? It has, you can already make out a few surfaces. Since I'm holding the bone somewhat anteriorly, you are seeing the anterior view of the ulnar bone. So this is the anterior surface of the olecranon process. This is the superior view of the olecranon process. Okay, superior view, right? This over here rather is the posterior view of the, or rather posterior surface. I'm sorry, it's view. Yeah, you are getting the superior and posterior views, but these are the surfaces. So superior, the anterior surface, superior surface, posterior surface, right? And a lateral surface and a medial surface. This is the medial surface, this is the lateral surface. Now, question obviously arises as to how do you know whether this is the lateral or medial surface? How do you differentiate the sides of the ulna? So obviously we need to know a few bony features for determining the side of the bone. But simply speaking, you can very easily say that this is the lateral side because there is a very characteristic notch over here in the lower side of the upper end of the ulna. This notch is known as the radial notch, and as its name suggests, obviously this will be articulating with the head of the radius. Now try to think of this. Ulna is the medial bone of the forearm, obviously we know that, and radius is lateral to the ulna. So if this will house the radius head, this must be the lateral surface of the ulna, or lateral side of the ulna. So this must be the lateral surface of the olecranon process, which we are talking about right now, and this must be the medial surface. Now let's talk about the fate of these surfaces, what they are forming. See, the anterior surface of the olecranon process forms the upper end of this notch, which we haven't talked about yet. Very characteristic this notch is in between the olecranon and coronoid processes. This notch is known as the trochlear notch. Okay, so the anterior surface, this will actually be forming the upper end of the trochlear notch. Okay, superior surface on the other hand does not have much going for it, except for the fact that this superior surface has a rough surface, or rather a rough area in its posterior side over here. This rough posterior end of the superior surface of the olecranon process will give insertion to the triceps brachii muscle. Okay, so the triceps will get inserted onto the rough posterior side of the superior surface of the olecranon process over here. Okay, and this part, by the way, this part is also forming the bony prominence of the elbow. So remember that. So this part, as you can, since I said that this is forming the bony prominence of elbow, that should automatically mean that this part is subcutaneous. Okay, okay. Posterior surface, if you can see, it is tapering at the end to form a triangular area like this. See, this is the posterior surface. This is actually forming a triangular area like this and culminating into this border which I am tracing downwards. Later on, we'll know that this border is known as the posterior border of ulna. So the posterior surface is continuous as the posterior border of ulna. Posterior surface of what? Posterior surface of the olecranon process. We are talking about the olecranon process right now. Okay? Excuse me. So, lateral surface. What about the lateral surface? Well, you can see that the lateral surface is continuous as a surface of the ulna shaft. This surface, later which we will come to know as the posterior surface of the ulna. Okay, so the lateral surface of the olecranon process continues as the posterior surface of the ulna. Don't worry, we will talk about this later. Posterior surface of the olecranon process continues as the posterior border of ulna, whereas the medial surface, this is the medial surface, is continuous as the medial surface of the ulna. Do not worry if you are not able to understand the surfaces and borders right now. We haven't talked about it, so obviously you shouldn't be able to understand them. So that more or less completes the olecranon process. Now for the coronoid process. Coronoid process, this is actually, as you can see, it is projecting forwards from the shaft just below the olecranon, and what will happen is that this coronoid process, this will actually have a few surfaces of its own as well. So coronoid process has a superior surface which, as you can see, is forming the lower part of the trochlear notch. Superior surface of the coronoid process. Coronoid process also has this anterior surface. Now, anterior surface of the coronoid process is a little interesting because it is rough. As you can all see, it is rough, but more importantly, I'm trying to draw your attention towards this very specific, look at the tip of the pencil, this very specific tuberosity over here at the lower end of the anterior surface of the coronoid process. This very distinct tuberosity is known as the ulnar tuberosity. Just like the radius had a radial tuberosity, ulna also has this ulnar tuberosity, this rough tuberosity, lower part of the anterior surface of the coronoid process. Okay, okay. Then that completes the anterior surface. Medial surface. Medial surface, just like the medial surface of olecranon, continuous as the medial surface of the shaft. No problem. Lateral surface. As you can see in the upper end, this lateral surface is forming this radial notch, which we just talked about. This is the radial notch, upper end of the lateral surface. Okay. Lower end, on the other hand, as you can see, it is forming a smooth, somewhat depressed area over here. Do you know what this smooth depressed area is meant for? Why is it depressed? This is depressed because this will be accommodating the radial tuberosity. Okay, so this part will accommodate the radial tuberosity, whereas a little posterior, this is the anterior side, this is the posterior view, right? So a little posterior to this depressed smooth area, we have this thing. Can you see? A crest over here. This crest is known as the supinator crest, as it is very conveniently written over here. When we will talk about attachments, we will know the supinator is attached to this region, and it is limited posteriorly by this crest called the supinator crest. Okay. That completes the two processes. What about the trochlear notch? Well, obviously the trochlear notch, it is an articular surface which will articulate with the trochlea of the humerus. We all know that it does not have much going for it. We have already talked about it in the humerus, the articulation in the elbow joint. Right. Now, let's very quickly talk about the borders and surfaces of the ulna. And along with that, we will also talk about the attachments. So obviously we can see that there is this border over here, glistening in the light. It is glistening, as you can see, this border. This is the anterior border of the ulna. Okay, this is the anterior border of the ulna. So if this is the anterior border, this side is the, as I have already mentioned, since this is the radial notch, so this side is the lateral side, right? So this border, this is the lateral border or the interosseous border, because obviously, as its name suggests, it will be giving attachment to the interosseous membrane. Okay, so this is the anterior border, interosseous border, whereas this is the posterior border. See, again, glistening. The borders are glistening in the light. Right? So these are the three borders. In between these three borders, we have three surfaces, obviously. Anterior border and posterior border. In between them, this, what did I say? That this side is the medial side, right? So this surface in between anterior and posterior borders, this surface is the medial border. This surface is the medial, did I say border? I'm sorry, medial surface. Okay. In between anterior and posterior borders. In between posterior and what border is this? Lateral border. Very good. In between the posterior and the lateral border, over here, we have the posterior surface. Okay. Whereas in between the anterior and the lateral or interosseous border, in between them we have this surface, which is the anterior surface. So again, a very quick rundown. In between the anterior border, can you make out that this is the anterior border glistening? Yes, this is the anterior border. In between anterior border, and since this is the medial side, this is the posterior border, right? In between anterior and posterior borders, since this is the medial side, this is the medial surface. Okay? I've turned the bone posteriorly. So this is the posterior border and this is the lateral border. In between the posterior and the lateral borders, this is the posterior surface, obviously. And in between the lateral and the anterior borders, this is the anterior surface. So the bone is somewhat like this, right? I have not yet held it anatomically, but I'm just trying to give you an overview of how the bone is oriented. So this will be the anterior surface, anterior border, lateral border, posterior border, medial surface, posterior surface. Okay, done. Now let's talk about individual borders, surfaces, attachments. Okay, now anterior border. As you can see, the anterior border, it is actually starting on the medial aspect of this ulnar tuberosity. Okay, so this is the ulnar tuberosity. On its medial aspect, the anterior border is starting, going down, going down, going down. Finally, what happens is, suppose this was the styloid process like this. Okay, the anterior border, this will actually end in the medial part, or rather in the medial side of the styloid process. Okay, so it terminates at the medial side of the styloid process. The styloid process would have been somewhat like this, right? And this side is the medial side. So as you can see, in the medial side, the anterior border is terminating. Okay, so that's the anterior border taken into account for. Posterior border. Posterior border, we had seen that the posterior border is actually starting as the continuation of the posterior surface of the olecranon process, right? On the triangular subcutaneous area, the apex of that actually continuous as the posterior border, going down. Finally, what happens is it will actually terminate at the base of the styloid process, because as you can see, this is the styloid process commencement area, which is broken again. I apologize, but the posterior border, this would have come down, and it would have ended at the base of the styloid process. Okay. The lateral border, the interosseous border. Now, as you can see, the interosseous border is very sharp in its middle part, just like the radius. In its middle part, it is very sharp, the sharpest of all the three borders. Whereas superiorly, it is pretty ill-defined, not well-defined, ill-defined, and inferiorly also not that well-defined. So it is only in the middle 2/4 that it is pretty well-defined, as you can see. However, superiorly we can comment that it is continuous with this supinator crest. This is continuous as the supinator crest. Okay. Inferiorly, on the other hand, this will actually move on, and it does not have a very characteristic fate like the two other borders, but inferiorly it can actually be traced to this side being the lateral side, so lateral side of the lower end. Okay, so it is somewhat like this. This is the lower part, the lower end, lateral side of the lower end, it terminates. Nothing much. By the way, there is a very important information. We haven't talked about the lower end yet, but if you do not know this, then this is the right time to know. Although this is the upper end, but in case of ulna, it is the lower end which is known as the head of the ulna. This is a very important information. A little confusing, I know. The lower end of the ulna is known as the head of the ulna, unlike radius, where the upper end is known as the head, or humerus, where the upper end is the articular head. In those long bones, upper end. In most long bones, actually, it is the upper end, the head part, then a neck part, constricted. Ulna, that is why I said it is a little unique in as far as its upper end is concerned. Its lower end, on the other hand, that is actually what is known as the head of the ulna. Okay. Now, this was the anterior surface, right? Anterior surface, a very important information about that is that this over here, okay, let it focus, yeah. This over here, I don't know how well you can see this, there is a foramen over here in the anterior surface. This is known as the nutrient foramen, which obviously will give passage to the nutrient artery, which in case of both radius and ulna, it is derived from the anterior interosseous artery. We'll talk about it when we talk about the forearm anatomy. And obviously it is directed upwards, because from the knee I flee, but towards the elbow I go. That's the mnemonic that you use to remember the direction of the nutrient artery. In case of the upper limb, the nutrient artery's direction is towards the elbow, but in case of lower limb, the direction is away from the knee joint. So that's how you remember. So obviously towards the elbow means upwards. Now let's quickly talk about the posterior surface. Which one is the posterior surface? This is the medial surface. This over here is the posterior surface. So as you can see, in between the lateral border and the posterior border, this is the posterior surface. One very important thing to note here is that in the upper part, I don't know how distinct this will be on camera, But in the upper half, the posterior surface is divided by this oblique line. Can you see this oblique line? Actually, it is a continuation of the supinator crest. But this oblique line, what it will do is, this is actually dividing it into an upper part and a lower part in the upper end of the posterior surface of the shaft. Whereas in the lower part, again, I don't know how distinct this will be, but here there is another border, another line rather, which is actually dividing it into what can I say, a medial and a lateral surfaces. Okay, so there are two lines over here. I don't know how distinct this will be, but I can see it pretty distinctly over here. Can you see there is a faint line going over here? Look at the light glistening off. This is the lateral surface, lateral border. This one is the lateral border. But over here there is another like slight line over here, which will divide this inferior part of the posterior surface. This is actually dividing into a medial area and a lateral area. Anyways, so that's more or less about the shaft features. Now let's get to the attachments very fast. Let's get on with the attachments of the ulna. So I had already talked about one attachment, which is the triceps. Triceps is inserted into the posterior rough part of the superior surface of the olecranon process. No problem in that. Now, what about the other surfaces of the process? So this was the anterior surface of the coronoid process, right? As you can see, the anterior surface of the coronoid process, this is actually giving insertion, this part. This is actually giving insertion to brachialis, including the tuberosity of ulna. So the ulnar tuberosity is also giving insertion to brachialis along with the anterior upper surface of the coronoid process, this part. Done? Done. Let's get on with the other very easy one, supinator crest. This part is known as the supinator crest. So obviously the supinator muscle that will actually, it is actually originating from this part, from the supinator crest and from this smooth area, this triangular area in front of the crest. So that is the supinator origin. Okay, that's another attachment dealt with. Let's deal with some of the forearm muscles, the flexor compartment. Okay, so now see, this was the anterior margin, right? This was the anterior margin. So this was also, although it's not too visible, or rather it is visible actually, do not worry. Okay, so look, this is the coronoid process, right? What side is this side? This side is the medial side. Very good. So this becomes the medial margin of the coronoid process. This is the medial margin. See, the medial margin of the coronoid process. This is the lateral margin of the coronoid process. Not that distinct. That's why I didn't talk about it initially. So this medial margin, the upper half of this medial margin of the coronoid process, this has a tubercle. This tubercle is actually giving origin to the ulnar head of, or rather, the ulnar head of the flexor digitorum superficialis muscle. Okay, so it is the ulnar head of the flexor digitorum superficialis originating from a tubercle in the upper end of the medial margin of the coronoid process. Okay, okay. Now, what else? Well, the ulnar head of the pronator teres, that also arises from the same medial margin of the coronoid process, but a little lower to the flexor digitorum superficialis. Okay, so listen, the ulnar head of the flexor digitorum superficialis, that is actually arising from a tubercle over here, a tubercle in the upper part of the coronoid process medial margin, whereas the rest of the medial margin very distinct over here. Rest of the medial margin, that is actually giving origin to the pronator teres. So superiorly flexor digitorum superficialis, inferiorly pronator teres. Both of them ulnar heads, not the entirety of the muscle, ulnar head of both these muscles. Okay, so coronoid process medial margin is very important. Okay, now let's talk about the bulk attachment of the shaft. Most long bones, they have a bulk attachment at their shaft surface, anterior surface mostly. Ulna is also not an exception to that. So this is the anterior surface, remember. What happens is the upper 3/4 of this anterior surface, that is actually giving origin to flexor digitorum profundus. Not only the upper 3/4 of anterior surface, but also the medial surface. So this entirety, anterior surface, medial surface, upper 3/4 completely, this is actually filled by the origin of the flexor digitorum profundus. This origin is so extensive that this does not stop at the medial margin. Rather, this will extend onto the posterior border of the ulna. Speaking about the posterior border of the ulna, we have another information. You see, the posterior border of ulna, this does not only give a part of the origin to flexor digitorum profundus, rather this actually serves as an attachment to the common aponeurosis to 3 muscles. One of them being flexor digitorum profundus, which we just talked about right now, and the other 2 being flexor carpi ulnaris and extensor carpi ulnaris. So listen to me again very carefully. This posterior margin all throughout, it is giving origin to, or other attachment to, if you want to play it safe, a common aponeurosis. Common aponeurosis, okay. Common aponeurosis to what? To 3 muscles. Flexor digitorum profundus, which is also having a very extensive origin all throughout the upper 3/4 of the medial surface and the anterior surface. Okay. Along with, I also forgot to mention, it also extends onto the medial surface of the coronoid and olecranon. So this is how extensive it is. So medial surfaces of olecranon, coronoid, upper 3/4 of the shaft, as well as the upper 3/4 of the anterior surface of the shaft, as well as the posterior border of the ulna. This is the flexor digitorum profundus. Whereas posterior border also serves as a common aponeurosis attachment for the flexor carpi ulnaris and extensor carpi ulnaris. By the way, flexor carpi ulnaris, let's talk about that. Let's talk about the attachment of flexor carpi ulnaris. Obviously, we are talking about flexor carpi ulnaris, but we need to understand that this is the ulnar head of the flexor carpi ulnaris, because all of them have a common flexor origin back at the medial epicondyle of humerus. So flexor carpi ulnaris, ulnar head, along with extensor carpi ulnaris and pronator and flexor digitorum profundus, obviously posterior border. But flexor carpi ulnaris, ulnar head also arises from the medial surface of the olecranon process, like this. So flexor carpi ulnaris, its attachment is somewhat, or rather origin is somewhat like this. Ulnar head, obviously we're talking about the ulnar head. Medial surface of the olecranon process, posterior border of the shaft. Okay. On the other hand, extensor carpi ulnaris, it arises only from the posterior border, obviously. Okay. Flexor digitorum profundus, on the other hand, I just mentioned what its entire attachment is. Another, since we are talking about this surface, this anterior border, let's talk about it. This lower part of the anterior border, as you can see, it has already been highlighted over here. Let it focus. Yup. This part, this oblique ridge, this is the anterior surface, right? So this oblique ridge, which is crossing the anterior border like this on the anterior surface, this ridge is actually giving origin to the pronator quadratus. Again, the ulnar part of pronator quadratus. Okay, so that's pronator quadratus, oblique ridge, and the lower part of the anterior surface. Okay. Now, what else do we have? Yes, we have the posterior surface. Now, posterior surface has a few, like 3 or 4 more attachments. So let's quickly deal with them. Let's start with this over here, this upper part. So as you can see, this is the olecranon process and coronoid process. So lateral aspect, this is the lateral aspect. Lateral aspect, which was later continuous as the posterior surface of the shaft, which I had mentioned. Lateral aspect of the olecranon and the posterior surface's upper 1/4. This part, it is highlighted as well. This part is actually giving insertion to the anconeus. Up to now we were talking about attachments, or rather origins, but anconeus, brachialis, triceps, these are inserted onto ulna. Now if you don't remember, I don't really blame you, because sometimes it might get a little confusing. Not really confusing for all muscles, because obviously you should not be confused as to whether triceps is getting origin from ulna or insertion. I mean, that's a very dumb confusion. No offense, obviously. Obviously it is getting inserted, right? Triceps is a arm muscle, so obviously it cannot originate from ulna. It must have originated superiorly. So same goes for brachialis. So some confusions obviously we should not have, but there are some which are a little tricky. Anyways, so anconeus, this is actually getting inserted onto the lateral part of the olecranon process, along with the upper 1/4 of the posterior surface of the ulna. Okay, speaking about the posterior surface of the ulna, we come on to the attachment, or rather origin, of 3 back-to-back muscles. Okay, 3 back-to-back muscles. From the superior to the inferior we will go. Okay, the first muscle is the abductor pollicis longus. Now remember, abductor pollicis longus also had a radial origin, right? Because this is how I remember, because abductor pollicis longus, so it's a long muscle, so it needs more energy, so it gets origin from both. Whereas this extensor pollicis longus, we don't see it in the radius really. Same for extensor indicis. So abductor pollicis longus, extensor pollicis longus, and extensor indicis, these are the 3 muscles which are inserted onto the, we might say, posterior surface. Obviously is correct, but to be a little bit more precise, the, what side is this? This is the lateral side, right? So lateral side, close to the lateral border of the posterior surface. Superiorly abductor pollicis longus, then extensor pollicis longus, and then extensor indicis. Okay, these are the 3 muscles. Then, since we were very close to the interosseous border, I think it would suffice to say that the interosseous border, as its namesake, gives attachment to the interosseous membrane. Now remember that I had talked about an oblique cord in the radius. Well, it is attached to the ulna as well, from the radius to ulna, like this. So oblique cord, it's attached somewhat over here in the green highlighted zone, which is, by the way, in the ulnar tuberosity. See, can you see? This is the ulnar tuberosity, and over here the oblique cord is getting inserted, or rather attached. Okay, now that brings the muscle attachments to an end. But what about some of the ligaments and all of that? Well, elbow joint ligament, or rather the capsule for elbow joint, not ligament, capsule for elbow joint, that is actually attached along the margin of the articular surface of the upper end of the ulna, along the olecranon and coronoid processes, so no problem with that. Remember, radius does not take or rather make any contribution to the elbow joint, so it is free from the capsule of elbow joint. Speaking about radius, this is the radial notch which is obviously lodging the head of the radius, and as we know that the head of the radius, that is actually put into place by an annular ligament. So the borders of the radial notch, what's happening is that the two margins of the radial notch of the ulna, the two margins, they are actually giving attachment. Okay, can you see the two margins? This over here and this over here. These are the two margins of the radial notch, and they are actually providing attachment to the annular ligament. Okay. So that's more or less about the attachments of the upper end and the shaft. Now a little bit about the lower end, which is by the way known as the head of ulna, which I just mentioned. You see, in the wrist joint there is something called the ulnar collateral ligament. Just like there was a radial collateral ligament, we have an ulnar collateral ligament as well. This ulnar collateral ligament, this is actually attached to the styloid process, okay, which is missing over here. Again, I apologize, but the styloid process, that is actually giving attachment to the ulnar collateral ligament. Now, very close to the attachment of the ulnar collateral ligament, the styloid process also gives attachment to the articular disc of the inferior radio-ulnar joint. So radius and ulnar, they form three joints in between them, so superior, middle and inferior. So the inferior radio-ulnar joint, that is actually the articular disc for that is actually attached by its apex to, actually the styloid process is missing over here, but it's actually attached to a part just lateral to the styloid process, very close to the attachment of the ulnar collateral ligament. Okay. So the styloid process will be somewhat over here, and when we will look at it anatomically or in anatomical position, the styloid process will be obviously posteriorly but medially as well. So posteromedially. So that's one cue. The next cue is you might say that this sharp interosseous border, just like the radius, that will also help you, and this radial notch, proving that this side is the lateral side of the ulna and this side is the medial side. Okay, and obviously this is very uniquely the upper end of the ulna. Okay, so this obviously becomes the right ulna, the right ulna. Okay, so we hold the ulna. It's not like you just hold it in its anatomical position, keeping the anterior border anteriorly, anterior surface somewhat like this. So it's pretty easy to hold. Okay, so that completes ulna for most part, I guess, and I'll have to go and see if I've missed something. I hope not, and I do hope that you also found this useful to some extent, I guess, and I also hope that you come back again for some other discussions of mine. Thank you very much, and goodbye. Yeah.